Hello everyone and welcome to the GMC show. I am Yash Kadlak, your host for the episode. Today we have with us Dr. Sunil Pandya sir. Dr. Sunil Pandya has completed his UG and PG from the Grant Medical College and Surgery Group of Hospitals. Sir further went on and became a famous neurosurgeon in the country. Apart from this, Sir is a passionate historian, an eloquent writer, and a down-to-earth person and a peaceful soul. In this episode of the GMC show, we are going to talk about his life, the story behind medicine, ethics, and his mentors. So, let's begin. Welcome, sir. Sir, you have reached the pinnacle of your career. Every big achievement starts with a small step. So when did you decide that you want to enter the field of medicine?
I'm not sure. I think it probably was in childhood because my uncle was a general physician in Lonavala. Now, at that time, which is prehistory as far as you are concerned, he was the only physician between Pune and Khopoli. There was no other physician at all. So he was very much in demand and he was very greatly respected because he was a good general physician. And Lonavala at that time was something like a summer resort for the wealthy families of Bombay. The actual summer resorts were Mathiran and Mahabaleshwar, but many times they would go to Lonavala because they bought bungalows over there or built bungalows over there. And so some of his clients were amongst the top industrialists of Bombay. And he was respected. And we used to spend almost a month every year during our summer vacation at his home. And, you know, being children, we would just watch what was happening and how he saw patients and how the patients responded. And so many of these patients were very poor patients because they were farmers or laborers in the Lonavala, Khandala, Khopoli area. And then we saw how he had a little dispensary where his compounder would prepare mixtures and powders and ointments and things. And seeing the response of his patients and seeing how he treated patients may have been an influence in looking to medicine as a career. And at that time we lived in Santa Cruz, and next door to us there was a physician, general physician. His name was Mr. C.S. Thakkar. I didn't know at that time, but much later I discovered that he was a very eminent member of the Indian Medical Association. And I now have photographs of him at the Grant Medical College giving a lecture in the lecture theatre, anatomy lecture theatre. But all this I didn't know at that time. But he was our family physician. And so we would go there, and he had filariasis of the upper limb. And that was the right upper limb. So when he held his pen, there was this big fat hand, and he would hold the pen and he would write the prescription. And so the way he behaved with our family, at that time we were sometimes very hard up for funds, so we couldn't pay bills regularly on time. And he never asked, "Why haven't you paid my bill?" Never, ever. So I think some of these experiences may have made me feel that medicine was good for me. And of course, I was never very good at maths, never, even today. So engineering was out of the question. And the two great science avenues were medicine and engineering. And engineering was out because I knew no maths, and so medicine.
Sir, did you read any book during your childhood, or let's say in your early teenage years, where medicine helped you, like as a guiding force for you, that you should join medicine? Was there any inspirational book for you?
There is an interesting historical fact. My parents had put me in a English language school. So they took me, although I was 1 year underage. The minimum age, there was a certain, and I was 1 year younger than that. With the result that when I finished my inter-science, I was 1 year below the minimum age at which you can join a medical college. So I had to wait for 1 year. I couldn't join. I mean, I applied and GS and GMC both said, come back after a year. You're too young. So I had to wait for 1 year. And my father's younger brother lived in Rajkot. And he was the tenant of a person whose son was in the GS Medical College and he was nearing his final year in medicine. So my uncle told me, why don't you go and see him and he may be able to tell you how to spend this 1 year in a productive manner instead of wasting your time. His name was Dr. Ashok Vaidya. And he eventually became an eminent clinical pharmacologist. And he's still with us. He now lives in Colaba with his daughter at the TIFR. So he told me, he's saying there are some books which I would recommend, which you should read while you're waiting. And the first book he recommended was a book called Aequanimitas. A-E-Q-U-A, Aequanimitas. And it was written by a man called William Osler. So he said, this book you must read. And then he gave me the names of 2 or 3 other books also. And so I looked for those books, found them and read them. Now this Aequanimitas is a collection of lectures which William Osler had given to medical students, nurses, young doctors, doctors who were just about to graduate. And they are all inspirational essays. They inspire you. And in these essays, he talks of ethics, he talks of the history of medicine, because he himself was a very eminent historian and a very eminent classic scholar, fluent in Latin and in some of the old languages. So reading that book was a great help. I mean, it showed me what path we should take as we become medical students and doctors. So I think that book was one of the books which influenced me.
Sir, how was GMC in your days? And are there any fond memories? And how did you meet Shobha ma'am?
I told you we were not very well off. So when I became eligible to join medical college, and at that time there were 2 big medical colleges. One was Grand Medical and the other one was Govindas Sundardas. Nair was there, but it was considered to be a relatively smaller medical college. So only if you don't get admission to one of these 2, you would go to Nair. So I applied to both Grand Medical and GS. At that time, we didn't have to pay on applying. You paid only if you were selected. So I applied to both. Now, Grand Medical sent me a reply earlier saying that you have been selected. And, using that principle, a bird in the hand is worth 2 in the bush, I went to Grand Medical and paid the fees. And 4 days later, I got a letter from GS saying you have been selected. But by that time, I already paid. And I couldn't afford to lose that money and go to GS. So that's how I came to Grand Medical. Now, our anatomy batch consisted of 11 students. You have batches now. The class is divided into batches. So, and in my batch was Shubha. So we came to know each other from almost the day we joined. But it took some time before she recognized me.
So were there any common interests between you?
Literature, history. I think these were the 2 main common interests.
Okay. Sir, GMC is known for its professors also. There have been eminent professors, and especially during your time. So would you like to mention some things about them or some of the great names?
Yes. At that time, all the clinical professors were all honoraries. Now, honoraries means they work from a certain time to a certain time. They are not there the whole day. And they were supposed to work from 9 a.m. to 1 p.m. After 1 p.m., they left, or they were supposed to leave. And they could do whatever they wanted, private practice, whatever, run a nursing home, whatever they wanted to do, they could do. And for this 9 a.m. to 1 p.m., they were paid the princely sum of 200 rupees as an honorarium. Now, even in those days, 200 rupees was not enough to cover their petrol costs coming from their home to the hospital and back. But most of them were graduates of the Grand Medical College. And so they had a fierce loyalty towards their alma mater. They had a tremendous loyalty, great bond. And although they became nationally and internationally famous, they stayed with their alma mater and they taught and they retired from Grand Medical College and JJ Hospital. So this was the kind of background of these teachers. Now, many of these teachers, or some of them at least, were seen to be working in the college and in the hospital up to 3 o'clock and 4 o'clock in the afternoon. They were supposed to leave at 1. I mean, there were many who left at 1, but there were some whom we saw working till 3 o'clock and 4 o'clock. I'll give you two examples. One is Dr. Naushir Wadia, who was the person who actually set up the effective department of neurology. The neurology department was originally set up by Dr. Menino D'Souza, but it was part of a general medical ward. And Dr. Wadia made it an independent neurology department. He was almost every day to be seen in the hospital till 3 o'clock or 4 o'clock. He would be going to see other patients, or he would be looking up references in the library, or he would go to the autopsy room to see what was found in one of his patients who had died, and so on. Similarly, Dr. Vijay Singh, who was the neurosurgeon, he would be operating till 2:30, 3, 4 o'clock. So we had Dr. Naushir Antya, who was there almost for the whole day. So we had such examples of honoraries who were working way beyond what they were supposed to work. And because they worked so hard, they were able to do research, they were able to publish papers and become nationally and internationally recognized. So we had this kind of teacher and we had this kind of teaching. I'll give you another example of an outstanding teacher. We had a subject called Forensic Medicine and Medical Jurisprudence. I don't know what the title is today, but that was the title at that time. Now, although it was forensic medicine and medical jurisprudence, forensic medicine means various abnormalities that you encounter, like stab wounds and murders and gunshot wounds and accidents and so on and so forth. And medical jurisprudence meant the relationship of medicine with law, how medicine affects law and how law affects medicine. So we had a professor called Dr. H.S. Mehta. He was a Parsi gentleman. He was a very, very knowledgeable individual in his field. And because he was professor of forensic medicine and medical jurisprudence, and he was also the surgeon to the police hospital, which is just across the road from the JJ hospital. So he was the police surgeon. So he was a police surgeon and professor over here. And he was in charge of all the medico-legal autopsies that were to be done. Now, at that time, for us, autopsies were extremely important. And particularly, Dr. Wadia and Dr. Vijay Singh used to insist that as far as possible, get an autopsy on every patient who dies in our wards. Now, what was the reason for that? The reason was that they wanted to learn about the disease process, about whether our treatment was right, or whether we had made some mistake. And this was particularly true when you do an operation. And we were lucky in that we had something called the Coroner's Act. So the Coroner's Act said that if there is any unnatural death, an autopsy is mandatory. And every operation is an unnatural death because a person dying after operation had died unnaturally. So we had this great loophole, shall we say, which we could use to get the autopsies on our patients. And H.S. Mehta was in charge of the medical legal autopsies. And we often went to see autopsies in the medical legal area and also our own patients who had died. Because there is so much to learn from autopsies. It's a pity that these days autopsies are not recognized, not being done, the numbers are dwindling. It's very, very sad. Because it's a great learning tool. What you can learn at autopsies in the autopsy room, you can never learn anywhere else, except on the patient's bedside. That's the only other place where you can really learn medicine. So anyhow, H.S. Mehta was in charge of that, and H.S. Mehta used to teach us. And because he was the police surgeon and in charge of medical legal autopsies, he was often called as an expert witness in all kinds of legal cases. And he was so eminent that when he entered the court, the judge often would stop all proceedings and ask him to deliver his evidence. He was respected by judges of the civil and the criminal courts because he was an outstanding medical jurist. And his evidence was very seriously considered by all the judges because he was so good. He was very, very good. Now, as part of forensic medicine and medical jurisprudence, he also taught us medical ethics. And much of what I have learned about medical ethics is from his teaching. And of course, from the examples which my teachers set me. I mean, there are two ways you can learn anything. One is by books and by teachers, and the other one is by what you actually see happening, practice. And in both instances, learning from teaching by Dr. H.S. Mehta and from my teacher like Pandya, Gajendra Singh, Antya, C.G. Saraiya. I mean, almost all the teachers that we had were extraordinary. And another outstanding teacher was Dr. W.D. Sulake. I don't know if you know about him. He was a professor of medicine, honorary physician, professor. He had his own unit, W.D. Sulake. At that time, his assistant was a Dr. Jatakia, who became famous in his own right. And he was the person under whom we did our first medical clinical term. That means we have come out of anatomy, physiology, and the very first medical teaching is by Dr. W.D. Sulake. And Dr. W.D. Sulake was a very, very simple person. He dressed in a bush shirt and a pant. He never wore a suit. He came by bus from Dadar to JJ Hospital, although he was professor and head of a clinical unit. I think he was the only person, only teacher who came in a bus, And his teaching was very gentle, but he taught us how to take a good history and how to examine a patient. Because we were there just to learn that. This was our very first clinical term, and he taught us that. And those lessons I've never forgotten. I mean, whatever little bit I know about clinical medicine, examination of a patient, taking a history, writing the findings, and all that I have learned from him.
Sir, neurosurgery was a nascent field at that time, It was not well renowned as now it is. But why did you choose neurosurgery?
After I finished my MBBS, I knew that I wanted to be a surgeon. I didn't want to be an obstetrician, gynecologist, pediatrician. I mean, I didn't want those areas. I wanted to be a surgeon. Now, the two glamorous areas at that time were neurosurgery and cardiac surgery. I mean, these were the two things which, attracted many of us youngsters. And during my internship, when I was still doing my internship, which was 12 months for us, I think it's still 12 months, we had a 3-month period where you're supposed to work in obstetrics and gynecology. I don't know how much it is now, but we had 3 months. And during that period, I wanted to go and see, while I was an intern, I wanted to go and see neurosurgery, I wanted to go and see cardiac surgery. It just happened that the first person I went to was Dr. Gajendra Singh, who was a neurosurgeon. And I told him, I said, look, I'm not sure whether I want to do neurosurgery or cardiac surgery, but I want to do one of these two, and I would like to see neurosurgery operation. He said, welcome. He was a most friendly and most welcoming kind of individual you could ever see. So he invited me, and at that time the neurosurgery theatre was in the Sassoon Hospital building on the top floor. And on the other wing was plastic surgery and I think orthopedics, but I'm not sure about that. So in that area, neurosurgery, there were other surgeons also operating there, and neurosurgery had its own days. So I used to go there to the Sassoon Hospital Neurosurgery Department theatre. And I saw those operations and I liked them. I liked the way the diagnosis was made and then confirmed. In those days, we had no CTMR, nothing. We had very simple tests like pneumoencephalography, ventriculography, and angiography. These were the tests, and myelogram for the spine. So I found that this was interesting. And after some time, Dr. Gajendra Singh asked me, would you like to spend 3 months in neurosurgery during your internship? So I said, I would, but there's no way I can do it because the internship program doesn't have neurosurgery. So he said, yes, but you have 3 months in obstetrics, gynec. And I know Dr. Saraiya very well. And if you wish, Saraiya at that time was the head of the department. He's saying, if you wish, I can talk to him. I said, yes, I would very much like that. Instead of wasting my time, if I can see neurosurgery 3 months. So he came with me and we went to Dr. Saraiya together. Dr. Saraiya was very much senior to Dr. Gajendra Singh. So he used to call him Gaji. And Dr. Gajendra Singh used to address him as Sir. So he's saying, sir, I have come to request you a favor. Gaji, he spoke in Gujarati because both of them spoke in Gujarati. Gaji, શું છે? Bol. What is it? Tell me what you want. So he's saying, this boy, he's showing some interest in neurosurgery and I want to encourage him. So I would like him to spend some time in neurosurgery, extended period of time. And so I'm not denigrating obstetric gynecology in any way, but he's not interested in obstetric gynecology. So if you could please allow him to spend those 3 months in neurosurgery. So Saraiya looked at Gajendra Singh in a rather stern manner. He's saying, Gaji, how do you know that this fellow is not going to cheat you and me both and disappear for 3 months and then he'll come back and tell me I have done 3 months in neurosurgery? So Dr. Gajendra Singh said, no, I've watched him for some time. He has been coming to neurosurgery theatre and I know that he will not do it. But in any case, if I don't certify, you don't certify. So I will certify that he has spent 3 months with me in neurosurgery. So that's how I spent 3 months in neurosurgery and then I was hooked. I never even went to the cardiac surgery theatre. Never saw a cardiac operation. Because Dr. Gajendra Singh was such a fine person as a human being and he was a good neurosurgeon. And he had trained in Vellore with Dr. Jacob Chandy, who started neurosurgery in India. So in fact, I told Dr. Gajendra Singh, sir, I would like to go and study neurosurgery in Vellore. So I said, sure. You write a letter to Dr. Chandy and I will put my remarks on it. And when we sent that letter, we got a letter back from Dr. Chandy saying, look, you are already with a very good neurosurgeon who was trained with me. Whatever you learn with me, you will learn with him. Why do you want to come all the way to Vellore to learn this? You already got a place in Bombay where you can learn neurosurgery. Don't come here. So that's how neurosurgery.
So was there any case that stayed with you over the time? Any fascinating case of neurosurgery you would like to share?
Many. There were many, but I'll tell you one particular patient who taught us an important lesson. He was a patient with hemophilia. Young boy, young meaning about 18, 20 years old, with hemophilia. And he developed a subdural clot. He had an injury. You know, these people, minor injuries, produce clots everywhere, knee joint, wherever. So he was admitted to Dr. Vijay Singh's ward with a subdural clot. And the subdural clot was pressing on the brain and causing some signs. I don't remember now what signs, but there were signs. And slowly he was worsening. So we decided that we'll empty out that subdural clot. Now at that time, one of Dr. Vijay Singh had an assistant. There were two consultants in each unit. One was the chief, Dr. Vijay Singh, and assistant. Now the assistant was Dr. Vijay Dave. Equally remarkable person. Extremely gentle, thorough gentleman, the kind that you don't see. He's dead now. Dr. Vijay Singh is also dead. But thorough gentleman, Dr. Dave. And he was so gentle that I was the registrar in neurosurgery. He was the assistant honorary and Dr. Vijay Singh was the honorary. So when we did rounds with Dr. Dave, at every patient he would ask us, the registrar and the houseman, what do you think we should do for this patient? And if we said something which was interesting, he would write down on the paper, as suggested by so-and-so, we should do this. You know, can you imagine what a boost that was to our morale? You know, you hear teachers who ridicule their registrars and housemen, and here is a guy who's raising you to his own level. Amazing. So anyhow, coming back to this subdural patient, Dr. Dave did the operation. I was helping him. And we evacuated the subdural, and this guy improved. I mean, he became conscious, and after 3 days, again down, because the subdural had reformed. He had hemophilia. Now, at that time, we didn't have all these factors which are available today. You know, you have hemophilia, you factor 7 or whatever it is, you give it to him, and now he won't bleed. There were no factors available at that time. They were available in America, but not in India. And if you wanted to import them, then you had to pay an astronomical cost. And this was a patient in JJ hospital who could never have afforded that sort of thing. So we were wondering, what shall we do? Anyhow, we evacuated a second time. Again he improved. Again after 2-3 days, he started going downhill because the clot had reformed. Now Dr. Dave also got worried. He's saying, I think we will lose this chap at this rate. So he's saying, let's go and speak to the hematology professor. At that time, Dr. Jagubhai Parekh, J.G. Parekh, he was the head of the department of hematology. He founded it actually. He was the founder of hematology department in JJ. And he had trained with Maxwell Winthrop. You know, Winthrop's tube for ESR and all that. He had trained with that man in America with Winthrop. So he was very, very well qualified. So we went and asked him. Dr. Dave asked him. He's saying, sir, we have this problem and we have drained this subdural twice and again he is worsened, and we can drain it of course, but again he will worsen. So Dr. Parekh sat with him and I was standing there and he was explaining to him, see, the actual cure is to get this factor and give it, but we have no access to the factor. So I think we are in a bad situation. But he's saying, I'll tell you something which I've done only once so far, and it helped. If you feel it will help, you try it. Now, we were willing to do anything which will help, but otherwise the boy was going to die. So he's saying, I had a boy with hemarthrosis of the knee, which kept on refilling after aspiration. So he's saying, I just took the blood of a normal person who did not have hemophilia. I just injected it into knee joint. But I said, the coagulation factors are there, no? In that fellow's blood. Let us see if it works. And it worked. The bleeding stopped. So he's saying, if you wish, you can try that. I don't know whether it will work. I don't know but if you take sterile blood, chances are it won't produce problems for the patient. So Dr. Dave was willing to try anything, otherwise the guy was going to die. So we took the guy in the theatre the next day, and I think from one of us, or maybe from one of the ward boys or somebody, very, very carefully sterile blood was collected, about 20 cc. We injected it into the subdural cavity, and the subdural stopped. So we learned this amazing lesson, which I have never seen reported in any journal so far, that if you inject blood of a person with normal clotting factors, it will stop the bleeding, which is a localized bleeding. It stopped. This guy went home. This was a very, very educational experience for me, and all because of Dr. Jagubai Parekh, because he suggested it never occurred to us, but he told us what to do.
Sir, was there any case of ethical dilemma where you were like, should I operate or should I not? Like, it was ethically wrong to operate. Let's say brain dead patient or something like that.
In JJ and in KEM, the patients that we get are the poorest of the poor. They come actually talking to you like, "Saab, aap to hamare maa baap hai, aap hamare bhagwan hai." So, trying to behave very strictly ethically with them is difficult. Because if you try and explain to them that, see, we want to do this operation and this operation is likely to cause these problems, the moment you start explaining, "Saab, hum kya jaane, aapko jo theek lage aap kariye." And he's saying it honestly, he's saying, "What do I know? You're telling me this complication will come. What do I know? I don't know all these things. I trust you. Yeah, I've come to you for treatment. I trust you. Whatever you think is correct, you do." So, although we took consent, it was actually not really the kind of consent that we should have got, simply because the patient wouldn't let us reach that stage. But the ethical dilemmas that we came across were later, and particularly in Jaslok Hospital. Now, from time to time, you get a patient who, for whatever reason, cerebral venous thrombosis or meningitis or some disease eventually becomes brain dead. Okay? So, we see the gradually progressive worsening, and then we see the signs of brain death. Up to very recently, that means up to about 5 years ago, we had the Organ Transplant Act, the 1994 Organ Transplant Act. And brain death is defined in the Organ Transplant Act. So as far as the law in India is concerned, there is only one act which refers to brain death, and that is the Organ Transplant Act. If a person is brain dead, and they lay down the criteria for the diagnosis of brain death, such an individual can be considered for organ transplant. That was the reason why this clause of brain death was included in the Organ Transplant Act, which is okay, that's fine. And they even told us what to do to diagnose brain death, bedside diagnosis, that you have to do this test, and the test has to be repeated after 6 hours. If the first test shows brain death, you have to repeat it after 6 hours, and if it is still brain dead, then you can tell the relative it's brain dead. And then of course you have to take their consent and do the operation or transplant or whatever it is. But what if an organ transplant is not being considered? Then what? Patient is brain dead. What do? Patient is on a ventilator, intensive care unit, it is costing thousands of rupees a day, and the patient is brain dead. And we have gone and spoken to the relatives and told them that the patient is brain dead and asked them, would they like to donate organs? They have said no. Whatever reason. No, we don't want to donate organs. Now what do? The law did not allow us to turn off the ventilator, take off the blood support, the hypertensive drug that we were giving. No. So you continue doing that, and sometimes it took 12 hours, 24 hours. We've had one patient who went on for 6 days. 6 days after brain death was clinically diagnosed, his heart did not stop. The blood pressure kept on falling. We kept on raising the dose of our drugs to raise the blood pressure. The amount of urine pouring out of his kidneys kept on dropping. But the heart continued to beat. Now what do? And the relatives are coming and asking you, you said my patient is brain dead now, give us the body. Because this is costing us a fortune, this intensive care thing. And we approached the administration, they said no, the law does not permit this. So this was a very big ethical dilemma, extremely big ethical dilemma. And in Jaslow, one of my neurology colleagues in the Department of Neurology, he decided, he's saying this is rubbish. If the patient is brain dead, they don't want to donate, we should stop everything and give the body. So he stopped everything and gave the body. Everything was written on the case papers. We have explained to the patient that the patient is brain dead. We have explained this, we have explained, all that was written. And then the patient's relatives were made to sign. All this has been explained to us and we have understood, and they themselves wrote. We have understood that the patient is brain dead, we understood that whatever we do is never going to survive, etc., etc., etc. Then the last line was, we are now instructing you to stop all resuscitative measures, take off the endotracheal tube and give us the body. In writing, we are instructing you. Now, legally you are protected because this is an order from the legally valid relative, representative of the patient. So you have to obey that. If you don't obey that, you can be taken to court. That I had told you to do this, you didn't do it. And therefore, we are going to sue you. So the body was released. The next day, he gets a note from the director of the hospital which says that it has come to my notice that this is what you have done. This is not as per the existing laws. If there is any legal case filed against you by anyone, this hospital will not stand by you. Clear, no? And we were shocked. We thought that the hospital will support us, That, okay, you've done the right thing, your notes are proper, the patients or relatives have ordered you to stop all resuscitation, give it to us. You got this and that.
Sir, is this the place where you got the idea for the Indian Journal of Medical Ethics?
There was a meeting at the Tata Institute of Social Sciences on medical ethics. And there were about 4 or 5 of us who had been asked to come and talk. So, whilst we were sitting in between 2 sessions having lunch or something, somebody who is not a doctor came to us. We were doctors sitting there. And he said, you guys are useless people. So we said, why? He said, you go on talking. This should not happen, that should not happen, this should be done, that should be done. What are you doing about it? Talking doesn't help. It's not going to do anything. Why don't you do something which will change the existing situation? And so the 4 or 5 of us who were there, we said, this makes good sense. We should have thought of it, that there's no point just writing and talking and lecturing. It's not going to do anything. Just at that time, the Maharashtra Medical Council elections were to be held. So we said, okay, as a first step, let us stand for these elections. So what else can we do? So we started 2 activities. One was, on weekends, we would hold lectures at the GS Medical College, because I was working there, so I had access to a lecture theatre. And we invited people to come. And initially we had about 40, 50, and then as time went by, it became 30, and then 20, and then 10, and then 5. So it faded away. And we had nice speakers, who would talk on different aspects of medical ethics. It didn't work. The other thing we decided to do was to start a newsletter on medical ethics. So we started, I think, 8-page or 16-page newsletter. And again, we were short of funds. So all the work which was done was honorary. And then somehow we would able to buy paper, and the person who did the printing, but typesetting the page setting was done free of charge for us by a friend and so on. That has now, and we were sure that this newsletter will die. In about 2 years or 3 years, the newsletter will die because nobody is interested in this. Luckily, it hasn't died, and it has become the Indian Journal of Medical Ethics. So,
Sir, there is a need of ethics and humanities in the field of medicine. Why is that? Why do you feel there is a need of strong ethics in the field of medicine?
ask any patient, they'll tell you why. Because unethical practices are rampant. Rampant. I mean, there's a tremendous amount of fleecing patients. There are touts who wait at the airport, not now, not during this lockdown, but before the lockdown. And taxi drivers, as soon as you get out, if you're an Arab chap, they will immediately tell you, आप hospital में जाना चाहते हैं, हमको एक बहुत अच्छा डॉक्टर मालूम है, आपको उनके पास लेके जाएगा, and so on. So there are innumerable unethical practices, and it is to the detriment of the patients. It is not, the patients are suffering because of that. About humanity, if you look at most public sector institutions, you will find that the patient is treated rather roughly. The patient is not looked upon as somebody who needs help, but he is looked upon as a nuisance. And there is a reason for that. In public hospitals, the OPDs are overcrowded. You know, there are 100, 150 guys waiting outside. And the OPD can only last for so many hours. And in that many hours, you have to see all these patients. So the doctors and everybody becomes a little bit abrupt in their management of the patient. But this excuse cannot hold in private hospitals, because the private hospitals are not so overcrowded and not so badly flooded. But even there, sometimes you will see a doctor talking rather curtly to a patient. Why are you asking me this question? You think you know better than me? I'm telling you it should be done like this. You think you know better? And now if somebody comes with the internet printouts, sometimes he's given hell. Well, if you have got all this information from the internet, why are you coming to me? You listen to whatever the internet says and do whatever you want to do. Don't come to me. You know, this kind of behavior is not what is expected of a doctor. A doctor is expected to say, I'm glad you've gone to the internet. I'm glad you learned something. Because now you may be able to understand better what I'm saying to you. You can say the same thing but in a different way. But that's not how some doctors behave. And there are other examples also of, rather inhuman kind of dealings with the patient. So I think medical ethics is desperately required. Now, the humanities are a different entity. The humanities consist of ethics, of course, but also consists of literature, arts, dance, theatre, photography, making a movie. All these things are part of the humanities. And some of us feel that our doctors, our medical students and our residents and our young doctors are deprived of the humanities. Almost from the stage where you reach the 10th standard in school, when all energy is put in getting 105 marks out of 100. Yeah? No games, no sports, no films, no reading books other than your study books, and so on and so forth. And the few hours that you may get tuitions, and now that is in medical colleges also, is rampant. In GS Medical College, when we try to introduce some such lectures on the humanities, we are told, don't put them on this day and this day and this day at this time and this time, because they have to go for tuitions. So these times are not allowed. Apart from the tuition time, you can put them on this time. So tuitions have come to become an overriding extra burden on the time available to students and young residents. And young residents are all the time trying to get the registrar's post and so on and so forth. So they are deprived of the humanities. I think, and not I, many people think that this is a shame. Because if you are not exposed to poetry, now I'm going to use English example because I'm familiar with them. If you are not exposed to Milton, if you're not exposed to the plays of Shakespeare or the plays written by Kalidas or works like this, if you're not exposed to the paintings by Ara or by Hussein or by any of these great artists, or if you're not exposed to poetry which is written by eminent poets in India, abroad, then you are poor. You are the poorer for not being exposed to this. Because these enrich you. They make you richer inside. But not everybody thinks like that, So the humanities are not part and parcel of the medical education program. Humanities should not be part of the examination culture. They should be outside the examination field. But they should be there. But they are not there.
This was the part 1 of the 2-episode series of Dr. Sunil Pandya's interview. In the next part, Sir talks about the history of our Grant Medical College, right from its foundation days to its glory days. Sir further tells his expedition in the history of medicine and gives his message for the future medicos. Sir also shares his foresight in the future of medicine and many more things. So stay tuned and please like, share and subscribe.